Anticonvulsants are a class of medications that aim to inhibit seizures by doing a variety of things.
So the first thing that they do is they block sodium and calcium channels in the brain, which helps to stabilize the nerve cells.
The second thing they do is they increase GABA in the brain, which is the inhibitory neurotransmitter that counterbalances neuronal excitation caused by increased glutamate. GABA levels are often low in patients experiencing seizures.
The third thing they do is that they also decrease glutamate in the brain, which is considered the excitatory neurotransmitter.
So all of these actions combined work together to increase the seizure threshold, which is a level of stimulation of the brain required to cause someone to have a seizure. They prevent generation and spreading of excessive electrical discharge from dysfunctional nerve cells, which is what causes seizures.
Anticonvulsant medications work fast to prevent seizures, as well as to treat seizures that are already in progress.
Do you or a loved one suffer from epilepsy or some other seizure disorder?
Are the effects of epilepsy interfering with your normal activities and daily living?
Yes, they are.
Are you sick and tired of letting seizures control your life?
Yes, I'm ready to take control.
If you're ready to take control over seizures and get your life back, we have the medication for you.
Currently, the drug of choice for treatment and prevention of seizures is Dilantin, otherwise known as phenytoin.
Dilantin works to limit seizure generation by altering ion transport and decreasing synaptic transmission, which in turn prevents seizures from occurring and decreases the amount of seizures experienced overall by the patient taking this medication.
Dilantin is indicated in patients like me with tonic-clonic seizures and complex partial seizures.
A tonic-clonic seizure is a type of generalized seizure that affects the entire brain. It is also indicated for patients with seizures that start on one side of the brain and spread, also known as a partial complex seizure.
Do not use Dilantin if you are allergic to phenytoin, have a history of liver damage caused by phenytoin, or are pregnant. Dilantin may cause fetal harm by increasing the risk of congenital anomalies and increase the risk of hemorrhage in newborns if taken by mother to term. Do not take Dilantin if you are currently taking Dilaverdine.
Use cautiously if you have liver or renal disease, severe cardiac or respiratory disease, or are currently lactating.
Take your medication as directed, at the same time each day. If a dose is missed from a once-a-day schedule, take as soon as possible and return to regular dosing schedule. Consult a healthcare professional if doses are missed for 2 consecutive days. Abrupt withdrawal may lead to status epilepticus.
Dilantin may also cause drowsiness or dizziness. Avoid driving or other activities requiring alertness until response to the medication is known. Do not resume driving until your physician gives clearance based on control of seizure disorder.
Avoid alcohol or other central nervous system depressants while taking Dilantin.
Behavioral changes: skin rash, fever, sore throat, mouth ulcers, easy bruising, unusual bleeding, abdominal pain, chills, pale stool, dark urine, jaundice, severe nausea or vomiting, drowsiness, slurred speech, unsteady gait, swollen glands, or persistent headache should be reported to a healthcare professional immediately.
Notify a healthcare professional if you experience thoughts about suicide or dying, attempt to commit suicide, develop new or worse depression, new or worse anxiety, or have feelings of agitation, restlessness, or panic attacks. Also contact your doctor if you have trouble sleeping or if other unusual changes in behavior or mood occur.
Side effects of Dilantin may include suicidal thoughts, ataxia, double vision, low blood pressure, liver failure, gingival hyperplasia, nausea and vomiting, rash, Stevens-Johnson syndrome, which is a life-threatening skin disorder, toxic epidermal necrolysis, which is a life-threatening skin reaction, or death. Contact your doctor immediately if you experience any of these symptoms.
If a tonic-clonic seizure does not resolve, or if such seizures follow each other in rapid succession, seek emergency help. The person could be in a life-threatening state known as status epilepticus. Ever since I started taking Dilantin, I feel like I have a new lease on life. I'm able to carry on with my life at work and at home without feeling worried about having a seizure at any given moment. I would highly recommend Dilantin to anyone with epilepsy or any other seizure disorder.
Ask your doctor to find out if Dilantin is right for you.